In 1860, a professor of medicine, Magnus Huss, initiated a fundraiser for the establishment of a care institution for the poor and incurable ill. 7 years later, in 1867, the Stockholms Sjukhem Foundation could open. And we are still very close to our original address here at Kungsholmen in the city of Stockholm. Now as then, our focus is on caring for the long-term and incurable ill. Today we operate on 2 different sites, Kungsholmen and Bromma, all in Stockholm. And from February next year, we also are present at Södermalm in Stockholm. Stockholms Sjukhem is a non-profit private healthcare provider owned and operated by the foundation with a strong sense to manage our history and our basic values to be accurate for the future challenges. We provide high quality care in several areas, as you can see, such as geriatric care, palliative care, rehabilitation, and elderly care. We facilitate both inpatient and outpatient care for about 350 patients every day, and we offered advanced home care for more than 200 patients each day. In our nursing home, we have 102 apartments. We also have a very strong research development and educational department in-house, and we have about 1,300 employees. Collaboration across silos is a challenge, both between the municipality and the county, as well as between different specialities. Many organizational setups today are based on a silo thinking and traditional care logic. In the future, we need a new logic to meet the challenges ahead, driven by the demographic development. Primary care, hospital care, domestic care service, and elderly care in nursing homes are all organized in public and privately owned organization or companies. They all want to collaborate, but it's not always an easy task due to the reimbursement regulation and tender procedure. I know it's possible because I have been experienced a successful model in Norrtälje, as Peter told us. The 10-100 model enhances cooperation and removes the boundaries that are not needed between public and private and between the municipality and county. By collaboration, it's possible to reach a higher quality for the inhabitants. I worked there between 2006 to 2012, before Peter arrived to Norrtälje. Some facts about Region Stockholm. Region Stockholm has overall responsibility for caring for the county's inhabitants and must meet the targets of the Swedish Health and Medical Services Act, which means good health and care on equal terms for the entire population. The region is one of Europe's largest healthcare providers, and it cares for approximately 30 to 35% of all care in Sweden. Most of the care is provided under the Region Stockholm's own management in the public. Around a third is dealt by private care providers such as family doctors, physiotherapists, maternity clinics, and hospital. We have a system, we heard Henrik told us, called Vårdval Stockholm, free choice of care. Vårdval Stockholm that gives the county's inhabitants the opportunity to choose care providers based on their own requirements, such as geographic location and opening hours. Reimbursement to caregivers is based on inhabitants' choices. By the end of 2017, there were approximately 2.3 million registered in the county. Year 2027 is calculated to be an increase to approximately 2.7 million. And by year 2060, the calculation ends up at 3.3 million residents. That means an increase of a total of 1 million residents by the year 2060. So by the end of the day, we really need to collaborate over the silos and really make sure that we provide the best possible care and welfare for all inhabitants. The city of Stockholm, in Sweden and more specifically in the city of Stockholm, the number of elderly in need of care are rising over the years. According to the city's official population forecast, the number of elderly people over the age of 65 in the city of Stockholm is expected to increase in the coming years. The largest population increase is expected to take place between 2020 to 2030. The forecast population increase is greater in the inner city of Stockholm City compared to the city as a whole, and this is where Stockholms Sjukhem operates. We are expanding with a new nursing home on Södermalm, the south part of the city, from February next year, and we see a future in expanding even more over the years to come. There are many different silos to talk about and collaborate in between in healthcare, one being the medical silos in healthcare. We need to consider two revolutions that both are having a real impact, the medical and the digital. These are disruptive events as the possibilities for personalization and freedom in time and space are paradigm shifting. The third revolution, which many talk about but few can concretize, is the organizational level. Therefore, many of the challenges remain. The need of and the ongoing simultaneous changes make the proportion of complicated, chronic and complex patients increasing. At the same time, larger parts of care are individualized and move to patients' everyday social context. This new landscape is illustrated by using a quadruple that shows different patients groups that between themselves have different needs and are consumption patterns. The four patients group you see are chronic care, a never-ending care, often within one specific specialty and in need of continuous care. And then you can see the complex multi-sick care, often an elderly, fragile patient. And you can see easy care, organized by functionality and organ. Complicated care, as you can see to the bottom of the right-hand side, patient flow throughout the system in episodes, but there is an ending on every occasion. The challenges that await healthcare and elderly care are great and exciting. Being a nurse myself, I see how much the nurses in our organization administer, plan, document, and try to make all logistics works for the patient during the care period, but also before the patient is discharged. Today, you can treat diseases and operate and rehabilitate well into the years, but we have less and less time for human contact. And we heard Bengt talk about it. Technology gives us great opportunities, but we must not make healthcare inhuman. It's about increasing demands from a growing population, about patients who are becoming increasingly knowledgeable, connected, and can do more and more themselves. About new ways of working, treatments, and drugs to be developed and disseminated. About digitalization, urbanization, globalization, and smart technology that pushes boundaries and views on who does what and how it's done. For this reason, managers at all levels must be involved in development and innovation work and support. With a person-centered approach, we see patients and residents as co-creators when we design and evaluate new knowledge, service, and services. Employees' professional knowledge is an important aspect in implementing change in a successful way. Professional knowledge is a combination with improvement knowledge is crucial for the result. The work is carried out with mutual respect and partnership that invites profession, patient, and residents' strengths and expertise. Now a few words about the COVID-19 pandemic and from the period February to November at Stockholms Sjukhem. Let me just mention a few words in regards of the pandemic and Stockholms Sjukhem. We have given care to more than 500 patients with an overweight on our geriatric clinic, as you can see. We have had more than 76 patients admitted at the same time in April. Protective equipment was unfortunately not in place from the beginning, so we started in-house production. There was a high stress level amongst the staff, and HR, human relation, was very supportive. Staff had and still have the possibility to have talks and dialogues with professionals outside Stockholms Sjukhem. We have been involved and contributed to the Forum's report, which was published in August. It contains 7 policy councils, as you can see at the picture, some of which I think are particularly important. We need better coordination between healthcare and healthcare actors. Today, it's difficult to navigate through our healthcare system as a patient and relative. An example is sampling costs that are made unnecessarily because IT systems do not talk to each other. Another is the old-fashioned handling of summon systems and referrals used by healthcare. I can do my banking errands and book my holiday travel with my bank ID. I can follow a package from sender to my door, but I can't follow a referral in healthcare. Despite the digital development, we need hands and feet in the health and care. Reduce the unreasonable requirements that exist in terms of administration and accounting. Let us create a more trust-based healthcare and give more time for our patients and relatives. Yet there are also opportunities. Some innovations are now quickly being taken up. What previously took months and years to implement can now take a few weeks in this pandemic experience area. Digitalization is taking great strides forward. Decisions that previously took years to investigate and decide on have only been implemented because they must be made here and now. This shows that there is an enormous potential in the healthcare staff, a potential that is not used in its full today. After the acute phase of the pandemic, much can be learned from that work, what worked and where it broke. However, challenges were large for Swedish healthcare even before the corona crisis. When the emergency situation is over, the long-term discussion must be less about demand for more resources and more about how resources can be put to better use. At Stockholms Sjukhem, we have three research, development and education platforms. We always want to develop and execute innovation between our business areas across all specialties. And here are some results. Business integrated development is created when RD&E's role becomes consultative and on demand from the business organization. RD&E is requested to support the profession in their work to develop the business based on needs, requirements, and expectations. Professional knowledge in combination with improvement knowledge is crucial for the result of the improvement work. As we say, we have two jobs: to do what we are trained for and one to develop. Stockholms Sjukhem wants to provide a seamless chain of healthcare for our patients, extending overall traditional county and municipal boundaries, built on collaboration between our specialties, geriatric care, rehabilitation, palliative care, and elderly care. Our intention is to meet the need more collectively, that healthcare and overall elderly care is in an organization that makes it easier for our patients and residents. The goal is to minimize and, if possible, avoid for the elderly needing to go to an emergency department unless medically justified. The patient should not have to navigate and understand the structure themselves. It's our job to make sure they are taken care of at the right level and with the correct medical and social conditions. We can and should always meet the needs in medicine, nursing, rehabilitation, and social, and by doing just that, we provide a better quality of life for those who live in our nursing home and our patients at our hospital. During the pandemic, geriatrics and rehab units was reorganized and ran COVID care together. Advanced home care was ready to take COVID patients. Palliative care assisted the region in staffing the Feld Hospital in Älvsjö, but also in supporting geriatrics with the infection consultant and assisted the region in developing a basis for the care of COVID patients in palliative care. We accelerated the digitalization with monitoring of patients in advanced home care and with reading tablets for the nurses working with inpatients care. There is a definite challenges coming to elderly care, and during spring 2020 it became clear for many that the structure set up in Sweden for our elderly in residence is not the best. The life expectancy is increasing, and thanks to great health care, we stay healthier and stronger even when we get older. That said, we also have a growing issue with the isolation of our elderly, as we tend to live at home even when we get lonely and weaker. The social impairment is accurate and hard. In Sweden, since the beginning of the 90s, we offer and push for home care in a wider perspective than earlier. To get a residential place at a nursing home is decided by the municipal and not always based on medical and social reasons. The goal for the municipal is to give domestic and home care for as long as possible. Another challenge that is already here is the lack of medical competence in Sweden. I won't go into why, but can just state the facts. That's the way it is. Since 15 years ago. Several activities are getting in place to educate and train more nurses and doctors with a specialty geriatrics. At Stockholms Sjukhem, we appreciate and invite educational centers to send their students and doctors to us. Stockholms Sjukhem make a unique investment that provides an opportunity to improve the state of knowledge and develop care and nursing for the most sick and fragile elderly. We have about 20 ongoing research projects, and we produce about 50 original publications and in total 2,000 student weeks nurses per year. Stockholms Sjukhem is approved as a unit for university healthcare from next year. To accomplish the best care for the individual, we do need good collaboration with the emergency hospitals such as Capio St. Görans Hospital and the Karolinska University Hospital, as well as the primary care and municipal healthcare. Naturally, we need to cross the silos within our own organization as well and put what patient and residents need first in all we do, think and say. This might sound obvious, but it's sometimes easier said than done. However, this is something management and our HR work with every single day. Through our values and the strong base in our foundation, we see how the staff, regardless of positions, do their very best every day. Trust that we can provide good care and attention with less administration and requirements for control and accounting. If we are to be attractive to tomorrow's employees, we need to modernize our healthcare system and take advantage of the opportunities provided and not give into inertia, rigidity and old power structures. Give the patient more power and let the patient navigate with a new technology. Then it will be person-centered care for real. The hierarchical structure we have in healthcare requires courageous leadership that dares to challenge and change, but that we really can achieve collaboration across silos. Thank you for listening.
Thank you, Karin. That was great. Very interesting, and there's so many things that you were touching upon. And I think one of the most challenging tasks is to actually get that seamless care where there are so many different providers actually in one chain of care for especially elderly people, and that's where we need innovation. Now I know that we have some questions on Menti, right, Magnus?
Absolutely. And I can go with a couple of questions before the break then, because now you need a break after some good but long presentations. The first one, Karin, now you need to be on your toes. Why should the IT system talk to each other when the professionals in healthcare system and its organization does not talk to each other?
It's very important that both the professionals and the IT system can talk to each other, because then we can deliver very good healthcare and elderly care if they can talk to each other. It's a very important issue.
I agree. It was just such a nice written question, so I just needed to raise it. How do we get managers and employees in healthcare to see digitalizations as tools for developing and improving the business, and see the tools as opportunities and not obstacles?
We must. I think the biggest issue is to be brave and show courage when we recruit managers to healthcare. We need both leadership and management who can take care of the patient, relatives, and the employees. And I think we need to have more pressure on our managers. We have to what do you say? Let me think a little bit. Do you have another question?
Of course I have. The last question before the break. It's always a nice one. Most of the Swedish regions and municipalities are very conservative and would not like to try new innovations and keep continuing the long-running routines. Are Region Stockholm being a role model and a leading regions out of the others? And if yes, why?
I think it's because 30 to 35% is private providers, both non-profit and for-profit actors, caregivers. I think that is one answer.
Yes, that's good. We end before the break then, Katarina, with Karin saying that private is better than public.
So, okay, thank you so much, Magnus, and thank you, Karin.